Hi everybody, I'm Dr. Jon LaPook, medical correspondent for the CBS Evening News with Katie Couric, and I'm here in the newsroom at the website, very excited to welcome you to the inaugural episode of CBSDoc.com. Since February is Heart Month, we thought we'd dedicate our first show to heart health. Did you know that heart attacks alone claim about 450,000 lives every single year? But many of these are preventable, and it's never too early to start lowering your risk factors. To check out my heart, I teamed up with New York City cardiologist Dr. Ben Lewis for a stress test. In honor of Heart Month, I'm putting my own heart to the test.
I think my heart's pretty good in terms of empathy.
And while I'm in the capable hands of Dr. Ben Lewis, a consent form is still required of every patient. The idea of a stress test is to make the heart work at least as hard as it does during maximal exercise. First, my chest is shaved in preparation for the procedure. Then, the electrodes are strategically placed on my chest to record the electrical activity of my heart. And a pre-exercise ultrasound of my heart is done to see how my heart beats normally. Dr. Lewis will be looking closely at my electrocardiogram, which measures electrical activity. If there's a blockage in any artery that's supplying my heart muscle, then there may be telltale changes in the cardiogram. This first stage is pretty easy, but as the test progresses, so does the intensity, and I'm definitely starting to feel the burn. After the workout, Dr. Lewis repeated the ultrasound of my heart. If there's a significant blockage, then part of my heart muscle may stop contracting normally. Once my heart stopped pounding and my blood pressure returned to normal, Dr. Lewis gave me the results.
How did I do, Doc?
You did fine. You performed at a high level of exercise, which is very impressive.
Good. I think people don't understand how valuable exercise is, for one, and what exercise really means. Exercise doesn't mean going to the gym. I've always said that your heart doesn't know what makes it go fast. So if you're active, physically active, your heart rate is increasing, you're exercising. Walking is the single most underrated exercise of all. I generally ask people to first look at their food likes and dislikes, and within that try and make healthy choices. Obviously, most of those involve raw fruits, vegetables, lower fat meals, less refined carbohydrates, lower sodium, and limitations on alcohol and caffeine. The majority of people who need stress testing, let's say at age 50, are generally people who are presenting with symptoms: chest pain, shortness of breath, palpitations, fainting spells, loss of exercise capacity. The next group would be people who've had a strong family history and have other risk factors. A risk factor would be high blood pressure, high cholesterol, diabetes, smoking. Know what your risk profile is starting out. Second of all would be to act on those recommendations in terms of lifestyle. That is to include specifically a daily look at your eating habits, your exercise, and attention to your body's shape, not just your weight. The American College of Cardiology has been increasingly proactive and wants people in their 20s to become aware for the first time what is their baseline blood pressure, their baseline cholesterol. So it's never too early to start as a young adult.
I want to thank Dr. Ben Lewis and his team for taking such good care of me during my stress test. I survived. That's a good thing. So what did we find out? Well, at-risk individuals displaying symptoms of heart disease, such as chest pain or shortness of breath, or those who have a family history of the disease, are the most likely candidates for a stress test. We also learned that good heart health doesn't necessarily mean spending hours at the gym. Walking is the single most underrated form of exercise. And finally, so important, whether you're 20, 30, 50, or 70, it's never too soon to start thinking about prevention. It's really the name of the game. Let's continue with this conversation. Send your questions and comments to doc@cbs.com. I'm Dr. Jon LaPook for CBSDoc.com.